environmental and behavioral factors associated with acute respiratory infections, efficacy of wearing masks against air pollution, and others. Dr. Shibata is also Executive Director of Global Environmental Health Lab. Through this nonprofit organization, he has been assisting hundreds of students, junior scholars, and young professionals from all over the world in improving their knowledge and skills to promote sustainable development. And I am so pleased to be joined by these panelists today, and as they get their webcams situated, I want to kind of continue on the history of Earth Day that Mayor Hagerty gave a bit about. So the first official Earth Day was held 50 years ago. Hi. Hey, everyone.
Hey, everyone.
I think you see us now. The first official Earth Day was held 50 years ago. And that day was created in an effort to bring awareness to the harm that was being done to our planet, to human life, and to plant life by industrial practices, and to advocate for better policy. Air pollution from industrial practices was and still is detrimental to human health. Water pollution is very dangerous to our drinking supplies and ecosystems. The result of Earth Day has brought about many changes in personal lifestyle choices, as well as federal policy. The EPA was a result of Earth Day advocacy, as was the National Environmental Education Act, the Occupational Safety and Health Act, and the more well-known ones that we know, the Clean Air Act and the Clean Water Act. So that was just a little bit of background. And so I want to turn it over to our panelists. Neela, tell us in 2 minutes or less, you know, we have about an hour, so what your current role is and why you chose to follow that specific career path.
Well, thank you for having me. I actually was like, can I do this in haiku? But then I thought that might be a little too artistic. So I chose a career in ecology and more so in academia, because I realized that there are very few researchers that are focused on asking questions relevant to the community that I belong to. I got into the environment from a science fair project. So 8th grade, 7th grade, my project was which environment decomposes waste the best. And as a child growing up in Chicago, we used to say, I don't have grass. We don't have grass, we have glass. There was a clear distinction between my environment on the south side of Chicago and other ethnic communities. My family also is from Altgale Gardens, which is situated in what's called the Toxic Donut. My grandmother was one of the first people to live in Altgale Gardens. So my history as a person growing up in the city, the environment gave me a different perspective being urban. And I felt as though it was, I love science, I love city, I love being able to focus on the intersections between nature and many other sectors. So policy, business, education, recreation, and a career in ecology really allows for me to explore all of those in with an equity lens. So that's how I ended up here.
Thank you so much. Really appreciate that answer. That we have glass, not grass. I haven't heard that one before, and it's very harrowing to hear that. So thank you for sharing that anecdote. Now, moving on to Dr. Carver, would you mind telling us in a few minutes or less what your current role is and why you chose to follow your specific career path?
Sure. Yeah, first of all, thanks to Brittany and Kumar and the mayor for inviting me and setting this all up. I'm really excited to be here. I wish we could be together in person, but this is the next best thing. So my role at UChicago, I'm an assistant instructional professor, which means I teach classes in urban and environmental studies and conduct some research on the topics that Brittany outlined in the intro. But how I got into this, I think similar to Neela, one's childhood winds up being influential. I grew up in Colorado, and one is lucky growing up in a context like that to have a lot of places relatively nearby to escape to. So there's there's actually plenty of opportunities to hike and camp, and my parents did that with us. So that was great. I got to sort of experience firsthand some of the results of the successes of some of those laws that Brittany was mentioning, you know, Environmental Species, Endangered Species Act, Wilderness Act, those kinds of things. So I was sort of had a firsthand familiarity with what was so special about environmental protection. But then later, living back in the Denver metro area as an adult and commuting across this sprawling city, I was confronted with the contradictions. You know, why are we able to protect some wilderness but still willing to live in cities like this that are so polluted and so sprawling? And so that's what drove me to get into urban planning in general and sustainable urbanism in particular. So I'll hand it on to the next panelist.
Great. Thank you, Dr. Carver. Moving on to Dr. Shibata. Would you mind telling us in a few words what your current role is and why you chose to follow that career path? I think you're on mute, Dr. Shibata. Let's see.
So, Dr. Shibata, you're gonna have to unmute yourself. There should be a little green microphone on your panel, your control panel towards the top. You should be able to unmute yourself there. We still cannot hear you, unfortunately. It says that you're self muted still. Brittany, while we're working that out, why don't you jump to the next question?
Great. Sure. So the first official Earth Day was held 50 years ago. Why do you think it's important to have a globally annual event to commemorate the environment? Dr. Carver?
Yeah, sure. I can start briefly. I do think it's we live in a global era, and any occasion to get together and talk about anything is special and valuable, and nothing unites us more than the planet that we live on. So I think Earth Day as a sort of an international holiday is self-explanatory. It should transcend all religions and languages and that sort of thing. I do think it's also interesting to consider it a holiday or a celebration, but also an occasion for protest. I think to keep that spirit of activism alive, I think, is quite critical. We've seen the environmental movement, I think, splinter a lot recently. So to the extent that something like Earth Day can bring everyone back together again, I think it's incredibly important.
Yeah, I absolutely agree. Especially as we're all socially distanced at this time, a holiday like this to commemorate the space that we all inhabit is of the utmost importance. Neela, do you have words to say about that?
I have a lot to say about that, Brittany. It's funny how 50 years ago is not a long time. And I live by the philosophy of think global, act local. And there are plenty of people who don't understand how these situations or connections scale up. So it's an opportunity to show the interconnectedness, especially in a global economy. And in the context of what we're experiencing now, individuals don't understand where their goods and products are made and how natural resources are impacted, or how the populations within those areas that are a part of the supply chain are actually being environmentally harmed. So we have people here locally talking about environmental injustice and environmental racism and water quality, air quality here, but failing to make the connections between their products that are made in other places and the environmental harm that's being induced because of that. So for me, it's an opportunity to let everybody know that this is all connected, right? Water, air, there are no boundaries. But we are a part of the problem, but we also can be a part of the solution, and that's an independent choice. So Earth Month, Earth Week, Earth Day for me is just a perfect transition for the rest of the year, right? We start off the beginning of the year, January, we're excited for the first month. February is Black History Month, right? So I get to talk about environmental justice in that context. March is Women's History Month, right? So then we talk about women and their impact on lots of things, but then it transitions into the environment. So it's this beautiful kind of stair step to talk about the intersection between social, economic, and then the actual economy on a broader scale.
Excellent. Thank you so much, Neela. I think Dr. Shibata is still working out some technical difficulties. So while they are still working on that, we'll just move into the next question, and hopefully we'll catch up with Dr. Shibata once it gets settled. So moving on into the next question, in the media recently, we've seen lots of news stories about environmental regulations being weakened, especially those that are supposed to protect community health. So some things may include relaxing regulations on coal ash from coal plants or weakening automobile fuel efficiency standards, and perhaps even cutting public response timeframes for infrastructure projects from community stakeholders mandated by NEPA. In the midst of a national health pandemic, do you think that climate policy can and should be a priority? Neela?
Yes.
Yes.
The short answer,
Yes.
absolutely. And I was reflecting on this, and there's so many nuances to it, right? It's a lot going on. And I've read lots of articles, even challenging the conversation of focusing on climate change policy instead of kind of parsing it out to focus on water policies or air policies, things that people can wrap their minds around. And then there's also the sentiment, at least here in Illinois, that I've been talking with my peers about how turning over or relaxing federal policies and giving power to those in the state also changes the dynamics. So I feel as though it's an opportunity for people within the environmental sector and people in environmental justice to work closely with state officials and state agencies for our locale, and we might be able to be more impactful at the state level with that opportunity. But absolutely, everybody does need to be mindful of how those policies create conflict for other communities. And if I could just get people to understand why it's important for us to acknowledge policies and legislation at various scales. So at the municipal scale, at the county, at the state, and acknowledge that there's work to do on all levels. And sometimes we can be much more impactful locally than we are at the federal level. So here in Chicago, Easter Sunday, there was a demolition that happened that resulted in a dust plume negatively impacting our neighbors in Little Village, right? We can do something about that as Chicagoans, and even as a county, right? Like we can come together and put pressure on industrial neighbors, and we can hold people accountable. We can vote for people to be in office that protect our interests. Those things are manageable. Those policies are manageable, and they are they're attainable within the time frame that we need them to be for our community. So I do believe we need to be focused on it, but we also need to be mindful of how we focus on policies at every single scale. Some might be more challenging, and that's the long game. Some are, we can fix this within, a fiscal year.
Great, thank you for that. want to pass it over to Dr. Carver.
Yeah, for sure. I mean, I want to echo everything she just said, but also to kind of come back to the core question, you know, should we be responding to the pandemic and to the climate crisis at the same time, which should take priority? I think it's a bit of a false distinction, actually. I mean, tailpipe emissions are sort of framed as a climate mitigation issue, and they certainly are, but we also know that tailpipe pollution causes asthma, which makes people more vulnerable to this particular kind of a pulmonary disease. So they're really not separate issues at all in a lot of cases, especially relating to air pollution in urban cities.
Can you hear me?
Yes.
And that demolition example that Neela cited as well is also just, you know, it would be funny if, because it's so blind, it would be funny if it hadn't actually resulted in such negative impacts on people. So yeah, I think they're like not even separate issues. And I would say also, the pandemic has made us more aware of the way that different parts of the world are connected in terms of supply chains, in terms of various patterns of travel and the nature of travel, certain kinds of travel that are carbon intensive, like jet planes and cruise ships turned out to be some of the most. I think this is just a coincidence, but it's the coincidence reminds us of how climate issues and pandemic issues are so interrelated.
Absolutely. I think it's really great that you said that they are all intertwined, and it's hard to separate the impacts of climate change from our everyday life, because it's so ingrained in every corner. And you know, this pandemic is really bringing to light those issues that sometimes are glossed over. So thank you for that, Dr. Carver. I believe Dr. Shibata has joined us, and I think his audio is working now.
I'm so sorry. I don't know what happened. It say muted by organizer, so I couldn't unmute. Can you hear me well?
Well, yes, we can hear you now. We're glad
Yes.
you are able to join us. So we were just on the question about, you know, there in the media, there've been a lot of news stories about environmental regulations being rolled back and weakened that protect community health. And so, you know, some of those things may include coal ash from coal plants being, those regulations being relaxed, or, you know, weakening automobile fuel efficiency standards. So in the midst of what's going on right now in our national health pandemic, do you think that climate policy can and should be a priority?
Yes, that's a good question. And I just wanted to make sure that people understand, you know, deregulation is nothing to do with, you know, COVID-19. Because ever since, you know, the president, signed the executive order 3 years ago, unfortunately, the EPA is, you know, deregulating, you know, 50 and hundreds of the, you know, regulation already. So it's already happening. So it's not about the COVID-19. And then speaking of the, you know, the regulation or policy associated with climate, I know some people have hard time to understand the climate impact, but then think about it. The cause of climate change is air pollution, and then even climate change may not directly impact you, you know, immediately, but because of the air pollution, it will directly affect your health, you know, especially, you know, chronic illness such as, you know, respiratory illness, cardiovascular, and then you may actually develop cancer because of air pollution. So those people, and also government, you know, people who have hard time understanding, you know, climate change, you know, regulation, environmental regulation is to protect the public health, and then that's directly, affecting human health. So prioritize or not, it should be always prioritized because environmental law protects public health, no matter what, it's pandemic or not.
Thank you so much for that, Dr. Shibata. And you were having some difficulties with your audio, so we didn't actually get to have you introduce yourself in 2 minutes or less, what your goal is and why you chose to follow that specific career path.
Yes. So currently, I work for Northern Illinois University as an associate professor. So, as a professor, we have like 3 responsibilities: teaching, research, and service. For teaching, so my role is to make sure students gain knowledge and practical skill to protect environment as well as the public health, including this pandemic. So I taught already more than 1,000 students. Every year we teach like hundreds of students. Some students already working in the healthcare setting, as well as local and federal government. They are working hard to protect the public health. And then for research, we conduct research in order to help stakeholders so that they can make a decision based on evidence. We don't want the stakeholder or government to make a decision just because of money, just because some people have a hidden agenda. We should make a decision based on evidence. So evidence decision is very important. That's importance for researcher. And then that is why I'm also executive director for non-profit organization to mentor hundreds of students and young professionals outside academia. The reason why I chose my career because I got the lifetime experience when I was a high school student. So I was Youth Goodwill Ambassador. I went to visit one of the developing countries in Southeast Asia. I saw people, living in the landfill, scavenging, something to wear or something to recycle, to sell the recyclable material for their living. I was high school student. I didn't know anything about how environment affects health, also social disparity. But then the moment I saw those people, I made my mind to study environment and the public health. And then that's my motivation. And then I cannot, make a difference by myself. So I understand the power of education. If I teach 100 students, then one of the students actually make a difference. So we have already power. So that's the reason why I make a decision. I make my career choice. And then I want to work for not only academia, but also non-profit organization, because many non-profit organizations don't want to work with academia or government. No, we should work together. So I coordinate, collaboration between, academia, government, and non-profit organizations.
Thank you, Dr. Shibata. Really appreciate that response. It's so important for us all collectively to work together in these times. And I think that's where we can get a lot of momentum, each puzzle coming together to really bring the outcomes that we want to protect our communities. So thank you for that. I want to switch gears a bit and focus on the health implications of COVID-19 and the impacts it's had on our region. We've been hearing a lot about the inequities in the healthcare system, as well as the high mortality rate among minority groups with COVID-19 deaths. In the Chicagoland region, it's been reported that 70% of COVID-19 deaths have been African American and Black Americans. Could you tell us a little bit about environmental risk factors that have contributed to this outcome, and how can we better support the Black community as well as other underserved populations? I'll turn it over to Neela for remarks.
You're going to put me on first, huh? I appreciate that. So I guess I want to begin for the audience to put this into context. Like, this is not something that is new. African Americans have been suffering from high rates of respiratory illnesses for decades. And there have been some intersecting, contributing factors to that. Some of that is the external environment and where we live. So, for example, in Chicago, we're highly segregated. We're top 10. If you think about the region, the Rust Belt region, or the Water Belt as it's called now, we have six of the top 10 most segregated cities in the post-industrial region, right? So where we live is highly polluted. We live in industrial corridors, transportation corridors. The quality of our homes also, so thinking about asbestos and lead and other pollution that's within those areas. So in 2014, an African American was 3 times more likely to die of asthma than their non-Hispanic white peer, right? Or children had African-American children are 4 times more likely to be hospitalized because of respiratory illnesses than a white child. These are things that we knew, thinking about the 1995 heat wave and how African-Americans died more. So elderly African-Americans died because of environmental factors, some planning issues, as well as some dynamics within our community. So we knew absence of trees and the presence of impervious surfaces contributed to extreme heat temperatures. Then we started talking about urban heat islands. But guess what happened thereafter, right? Studies showed that we needed more trees. Then what, right? What types of actions were taken by officials and elected officials, whether they were from our community or from the city, to make sure that we had trees in the appropriate places to give us the appropriate relief, right? So as somebody who's interested in ecosystem services, it is my goal to help people recognize that the natural system, the absence of it, the quality of it, the location of it, actually impacts the quality of the environment, which leads to some benefits for people, but that environmental injustice and environmental racism is something that people of color have been dealing with. That's something that we need to address. And the health issues that we're seeing now has been the fight for environmental justice researchers. There are people that are anchored, or their careers are anchored in disproving that industry or planning has a negative impact on human health. This is what we've been saying. So for me, this is like, it's shining this big light on the reality that we've allowed industry and we have created decision-making processes that sustain environmental harm on a group of people, and we're not doing enough to address it systemically.
Yeah, I think I'd love to, eventually in the panel talk about, what changes systematically we can think of implementing, because, it's oftentimes hard to individually, do something to change these ingrained and practices and inequities that have been in these communities for so long. And it really needs to start at the top, where we can have a lot more momentum and a lot more authority there. So I really appreciate that perspective.
And I just want to say, Evan, you're the first researcher that I've seen that has a connection to segregation. That is something that is brand new for me, and that's why I was really excited to sit on this panel with you, because that's not been a part of the conversation within the ecological sense. So,
yeah, Dr. Carver or Dr. Shibata, if you have any remarks for that question.
Yeah, sure. So, I mean, I think you did a great job introducing one of the big elements of environmental injustice and the health impacts of environmental justice. Particularly these respiratory, these chronic respiratory diseases that are now associated with much higher mortality rates from COVID. I mean, I just want to echo the first thing you said, which was, when that news came out about the proportion of various ethnicities that were and the mortality rates. It was extremely sad, but also not at all surprising. This is because of everything that we know about the history of environmental justice, especially in places like Chicago. This was the expected outcomes. So Neela talked a lot about I think air pollution, industrial areas, transportation corridors. The other aspect I think is worth highlighting is that these black and brown communities, often the result of redlining and that sort of thing, also have higher rates of diabetes and obesity, which are negative comorbidities for COVID as well, and those have built environment causes in many cases. These are neighborhoods where, because of a history of disinvestment, they're food deserts, meaning they don't have good coverage of grocery stores and access to fresh and healthy food. They are so people's diets are not quite as good, and they also tend to be neighborhoods that are not very walkable. So meaning the actual quality of the sidewalks, the quality of tree canopy, which Neela was mentioning, and even just the way that the neighborhoods are set up, the kinds of businesses, the way that businesses relate to the streets, frequency of parks and benches for taking a break, frequency of traffic calming measures to keep traffic quieter so that it's more comfortable to walk on the streets. These neighborhoods are places where people are discouraged from having sort of active transport, walking and biking, and that's also then correlated with higher obesity rates and that sort of thing. So what cities could do is work with grocery stores to incentivize them to put up stores in these areas. It's a low margin business, so incentives will be required. We can also work with communities to prevent so many dollar stores and that kind of thing. And then, of course, the city, through its parks and public works departments, can invest directly in the streetscape and in the quality of the built environment in these places in order to make them safer and more attractive places to be outside and to be active. And that would all have positive health impacts all the time. That would make people healthier all the time, not just more resilient when a novel pandemic comes down the road.
Thank you so much, Dr. Carver, for those remarks. Dr. Shibata.
Yeah, sure. And then, I just wanted to say first, health is a human right. Health is a human right. So every human being should have a healthy life. But then, unfortunately, environmental and social, factors that affect human health unfairly by race. So that's what you guys already mentioned. And then, I have conducted research in, the country, and then we monitor actually air pollution, and then, compared to the, incidence rate of, acute respiratory infection, it's beautifully correlated. So actually, this is science that if you live in the polluted area, you actually elevated risk of acute respiratory infection, COVID-19's acute respiratory infection. Okay, and then Neela mentioned about some water and lead. Yes, studies show that if you are exposed to high level of lead, you are more likely to increase risk of chronic obstructive pulmonary disease, COPD. It's heart disease. That is a risk factor for acute respiratory infection. And then also Evan mentioned about those lifestyle, the obesity, diabetics. But then I always tell students that yes, America is a big issue for obesity. If we kind of blame individual, hey, you are obese, it's your fault, we are not going to fight obesity. Okay. We have to provide a system or environment. So actually, as Evan said, people can walk, people, don't have to, drive for miles to go to work or go to, gym. It's so ridiculous. You have to drive 10 minutes to go to, actually walk in the indoor site. So we have to change the more like a living system. So I gave a student assignment, change like a lifestyle through designing built environment. So instead of asking you to change behavior, so how can we change the system or environment so we don't have to worry about it? Okay, so if we can provide, actually more support. I know that, City of Chicago and federal agency provide grants to remove lead, but then, those who are, having low income, they cannot afford to change the lead pipes. That is accumulation of the issue. Okay, so program, we have to promote more, support to removing environmental hazard, and then at the same time, yes, I agree with Evan that we have to promote changing lifestyle. But then, important thing I wanted to say is back to the lead exposure. All we remember that Flint, Michigan. Okay, that was a disaster created by the wrong decision making because they wanted to save money. The current administration are doing the same thing, deregulation because of the cost, because of the economy. Okay, so it will create, those deregulation is creating more human health disaster.
All right. Thank you, Dr. Shibata. Really appreciate those comments. We're going to move along to the last couple of questions, and I did want to remind our audience, if you did have any questions, feel free to enter those in the Q&A box, and if you are if you're joining us from the phone, you can email sustainability@cityofevanston.org. So moving on to the next question. As we've heard before, in 2018, the City of Evanston passed its Climate Action and Resilience Plan. And at its core, equity is really important in how we think about each section. When we think about community networking and educating our residents, how we do emergency preparedness and management, which we've had to do a lot of right now during this pandemic, and how we assist our vulnerable populations. So what are some of your thoughts on the importance of resilient communities?
Okay, I can go. Yeah.
Yeah.
So I just saw the plan of the City of Evanston. That's so amazing and so impressive. But a lot of very, I'd say, ambitious goal you have. Then in order for you to achieve those goals, I would say, it has to be effortless effort. If people try to do so much, it's not going to be, sustainable. It has to be effortless effort. So people don't have to make effort to, let's say, think about recycling. Okay, recycling is an important part of the sustainability and the resiliency. And then, some people don't recycle because there's no recycling bin. Okay, so, and also the most effective way to do recycling, and actually in the United States, 99% of the car battery has been recycled because people don't have to do anything. Okay, the dealer can take care of it, and if you change the battery, people can get the immediate benefit. So those kind of system, effortless effort, and also win-win system has to be introduced. And also system thinking approach. I saw that there's so many stakeholders involved. And then everyone wants to be, hey, I'm the leader of this group, I'm a leader, but then you have to integrate those, the stakeholder. That's why you set the communication, but then, no one is perfect. So many multiple, intervention can figure out their, weakness. And then you have to provide, have a short-term and long-term goal, And then again, do not be too ambitious. Okay, that is important. It's gonna be long run.
Thank you, Dr. Shibata. We're all in this for the long haul, and we're all going to be trying and working together. I think for this question, we could take one other perspective. If Evan or Dr. Carter or Neela would like to share, or we can just go into the next question.
I think I have something to say. First of all, kudos to Evanston. I was just about to move there before I got wooed to Hyde Park by the rest of my family. And I just want to say to Mayor Hagerty, he probably jumped off, that these are the types of practices that a mayor is showing that he is able to work across sectors. So working with academics, working with nonprofits, knowledgeable consultants in order to create plans at various levels that move this city into the direction that it needs to be. So I'm just really impressed. And also Evanston is one of 3 cities in the state of Illinois that are part of the Great Lakes St. Lawrence Cities Initiative, right? So this mayor has created this environment for other professionals. I mean, hence we're here. We are here. Brittany, you're here. Kumar is here, right? So there is a reflection about what are priorities, and you build a resilient community by also having decision makers of like minds at various levels across sectors that can address education, that health, transportation, and embed those philosophies at appropriate scales. So what's the importance of it? You know, when I think about how climate change is going to have new winners and losers here in the Great Lakes, we're actually going to be gaining some people, but who are we actually going to gain? And as we amend our practices and communities shift demographics over time, a part of me thinks like, are we really prepared for the people that will be moving in? Like, what is the definition of a resilient community? Is it a community that we're protecting? Is it a community that can protect itself against certain harms? Because for me, I am not confident that segregation is sustainable, right? Can we have a resilient city and segregation? Can we have a resilient region and have 6 of the top 10 most segregated cities within that region? What is the definition of resilience compared to scale? So I think that we also need to acknowledge, are we doing enough to protect, or not even protect, but to reverse the harm that was induced because of environmental racism at every single level, in order to have our vulnerable populations not be vulnerable populations anymore? Like, for me, like, those are some of the things that I'm most kind of top of mind.
Excellent. Well, thank you, Neela. We'll move into the next question. We've kind of made this transition from thinking about the Earth and our communities from a global scale, and thinking about the way that we are handling COVID-19 combined with our climate work and work with populations. But let's move into post-COVID. What is our world going to look like after we've endured some of these conditions and we've lived through this? So I'm really interested in hearing Dr. Carver's perspective on this. You know, how do you anticipate residents' interactions or community member interactions with nature and their environment in the aftermath of COVID-19? You know, will we be going outdoors more? Will we be more cautious to have events in close proximity? Maybe an increase in urban agriculture? What are your thoughts there? You study a lot about like individual interactions with the environment, so interested to hear your perspective.
Yeah, sure. So the first thing I should say is that I do not know what the world looks like post-COVID. I'm not an epidemiologist, and I think the epidemiologists also do not even know. We don't know how the virus itself is going to change. We don't know how our various treatments and vaccines will emerge. It's possible that we're stuck in an arrangement that's not too different from this for many months. It's possible that things can return back to something normal-ish fairly quickly. I don't think anyone really knows. But in terms of the way that our relationship with nature change, and in particular urban nature changes over this time, I'm actually actually pretty optimistic. I mean, we've seen just, you know, in these first few weeks when people are confined, this sort of emergent biophilia or re-emergent biophilia, I guess. You know, people posting about the dolphins returning to Venice or whatever it is. Some of those anecdotes are not factual, but many of them are. And so I think you see this this attention toward the immediate environment around people. People paying much more attention to the green space, or even you know, just the smallest of spontaneous urban flora, sometimes called weeds. But even that sort of thing is this renewed attention toward life, toward non-human life in our immediate vicinity. And I think that's really exciting. I mean, I think that can only be a good thing long run. I do think that you know, one of the sort of challenges with environmental policy and political and social support for environmental policy is that there can be a lot of attention paid toward you know, charismatic megafauna and the most kind of spectacular wilderness areas. You know, as great as the successes of the reintroduction of wolves in Yellowstone is, it's actually, we're doing ourselves a disservice if we look at that and pat ourselves on the back and say good job, because there's so much work to be done closer to home. And I'm just extremely optimistic that this renewed attention to home that we are all being sort of forced into by spending so much more time in our immediate communities will bear positive fruit on that front.
Absolutely. And we are running short on time, so I want to move us into our last question about like action. Like what can we do? What kinds of policies can people be advocating for? You know, we're in such a weird time right now, and most people wish that we could regain some sense of normalcy, like you mentioned. And this pandemic has brought to the public eye a lot of the glaring social and economic issues that have been here and have existed, but it's so hard to ignore now. So, you know, what kind of things should we be advocating for, you know, to improve conditions for all community members? You know, policies that, you know, may decrease carbon emissions and increase renewable energy usage in Illinois, better public transportation. I know that you all mentioned a lot of those things prior. Neela, do you have words?
I muted myself. I think I would like to lift up policies for not at the city level, but policies for businesses, right? So we're seeing now that people very quickly transitioned their in-person teams to working from home, right? And they were able to do that, and productivity might have shifted somewhat, but how much carbon is being saved because of this, you know, building not operating and people still being as productive at home? So in my opinion, I think that after this or during this, businesses should reflect on what their role is in reducing emissions because of transportation. So policies that will help support people, as well as policies that hold people accountable. So landscapers, for example, you don't have to have any special requirements to get a city a city bid approved, right? You can have unsustainable practices, for example. You don't have to use, there's no requirements. So I think there's also some reflecting to do about policies for people who engage and manage nature moving forward, so that these people are educated, they're giving best practices, they have water conservation practices, and that's for all sectors, especially for the cannabis sector that's coming into the state of Illinois. So I would like to see policies at those levels protect the environment and support environmental ethics for individuals at that level.
Thank you so much. I told you guys this was gonna go really fast. We have 5 minutes left, so I want to turn it over to Kumar if there were any questions submitted. We would like to go through those.
Thanks everyone. Really amazing panel. I feel like I've learned so much. I'm just very appreciative of having you all join us today. We've actually only gotten one question through our various ways to solicit questions. So maybe next time around we'll have to find a different format to make it easier for folks to submit questions. And this question came from a resident, and they're asking, what can residents of Evanston do to reduce waste products going to the landfill?
So Kumar, can you type that in the chat box for me?
Absolutely.
Or copy and paste?
Yes, I can. Let me do that really quick. I am moving it over now and should be able to see it now.
So I can say something to this. I mean, because I've been thinking about this a lot recently. The best way to have fewer things wind up in the landfill is to have fewer things to send to throw out in the first place. So that means reducing packaging and reducing one-use products and that sort of thing. But this is a bit of a challenge right now. There's a lot of progress was made, with grocery stores and reusable bags, with coffee shops and reusable mugs and that sort of thing. And unfortunately, the public health imperative has driven us back toward a lot more disposable packaging. So this is actually a really important challenge that I think we're going to need to answer. Materials manufacturers are going to have to come up with some strategies. Maybe the way checkout lines are configured and that sort of thing may have to be rethought. But I would still say the best way to have fewer things wind up in the landfill is to have fewer things that you need to throw out in the first place.
Yeah, so in order to reduce the amount of trash we send to landfill, it's reduction, recycling. Like we can 3R, reduce, recycle. Okay, so many of municipal solid waste, SF, consist of food scrap, paper, and then also like those recyclable materials. I teach, environmental health, the course contains the, solid waste. And then I always tell students, and this is for everyone, there is no waste, okay? Everything can be recycled or reused. And then, even food scrap can be composting, and the food waste can be reduced by, if you go to grocery store, there's so many food available. But then some of food never go to the your kitchen. Okay, there's a system for the service to provide food to the homeless or low-income family. But then those systems have to be provided, and then we have to improve more recycling. Okay, and then even landfill, if you install the energy production through methane, it can be still, sustainable. So waste is not waste anymore if you recycle or reuse. Okay, so we need to think about waste is not waste, it's resources.
Thank you, Dr. Shibata. Thank you, Dr. Carver, for your remarks on that. And just letting residents know that, we do have recycling services that we provide to our community members, and there are also composting services for Evanston. And just so you know, food and yard waste service has started now. So you can check out the city website for more information about that. So we are winding down. 60 seconds left. I really, really enjoyed this discussion. Thank you, panelists, for being with us here today. And, you know, at the end of this session, we will make sure to get our slide deck out to all people that have registered for this event. And if you haven't registered, just email sustainability@cityofelvanston.org so that you could get that slide as well. Thank you all so much for joining us today. It's been a pleasure being your moderator and host, and I hope that everyone has learned something new today and maybe taken something to ponder and taken something that maybe you want to enact and put some action behind it. So thank you all. It's been a great time.
Yeah, I'm looking forward to see you face to face in the future.
Absolutely. So we have the contact information for our panelists here. And if you do have any questions, they can be contacted below. And we will make sure to send the slide deck out to everyone. So thank you so much, everyone, and happy Earth Day. And
happy Earth Day, Earth Month, Earth Week. Bye, everybody.
Bye.
All right.